Welcome back to another episode of the Lost Book of Herbal Remedies. I'm Alex.
And I'm Emma. Today we're diving into some groundbreaking research on non-small cell lung cancer, or NSCLC, and exploring how it's changing the landscape of lung cancer treatment and patient care.
Right, lung cancer is a major health concern worldwide, and NSCLC is the most common type. Recent studies have brought new insights into how we understand and treat this disease. Let's start with the role of tissue-resident memory T cells, or TRM, in shaping the tumor-immune microenvironment, often called the TIME.
Absolutely, TRM cells are fascinating because they reside in peripheral tissues like the lungs and play a crucial role in immune surveillance against tumors. A comprehensive meta-analysis using single-cell and bulk RNA-seq datasets has shown that higher levels of TRM in NSCLC patients correlate with a more favorable immune environment. This includes higher levels of CD4 plus T helper 1 cells, M1 macrophages, and resting dendritic cells.
That's interesting. It sounds like a better immune environment means a better chance for the body to fight off the cancer. Researchers even developed an 18-gene risk score based on TRM signatures to help stratify patients into low-risk and high-risk categories, providing a powerful prognostic tool.
Exactly, Alex. Patients classified as high risk had significantly lower overall survival rates compared to low-risk patients. This risk score has been validated across multiple independent NSCLC datasets, highlighting its potential for clinical use. Another important aspect is the differences in TRM abundance between lung adenocarcinoma and lung squamous cell carcinoma, suggesting different immune mechanisms at play.
It's incredible how much we're learning. Now let's talk about pneumonitis, a significant concern for NSCLC patients undergoing immunotherapy. A systematic review and meta-analysis of randomized controlled trials revealed that nivolumab and pembrolizumab, common immunotherapy drugs, are associated with higher incidences of pneumonitis compared to atezolizumab.
That's right. Specifically, the incidence of any grade pneumonitis was 4.5% for nivolumab and 5.1% for pembrolizumab, compared to just 1.6% for atezolizumab. This finding is crucial for oncologists when selecting immunotherapeutic strategies and managing potential adverse effects.
And it's not just the type of drug. Treatment-naive patients, those who haven't undergone previous treatments, also have a higher risk of developing pneumonitis. This highlights the need for vigilant monitoring in clinical settings.
Moving on to surgical recovery, the Enhanced Recovery After Surgery (ERAS) protocol has been a game changer for lung cancer patients. A recent study identified that longer operation times and suction drainage are risk factors for ERAS failure, particularly in patients with concomitant cardiovascular disease.
Improving surgical efficiency and postoperative management is vital, especially for patients with underlying health conditions. By optimizing surgical techniques and drainage management, healthcare providers can significantly enhance recovery outcomes.
Speaking of surgery, neoadjuvant therapies, treatments given before the main treatment, also play a significant role in surgical outcomes. A study comparing neoadjuvant targeted therapy, NTT, and neoadjuvant chemoimmunotherapy, NCI, found that NTT led to higher rates of minimally invasive surgery and fewer postoperative complications.
That's a big deal. It suggests that NTT could reduce surgical complexity and improve short-term outcomes for patients with locally advanced NSCLC. Now, let's pivot to something close to our hearts: herbal remedies.
Yes, from the Lost Book of Herbal Remedies by Herbal Bloom, we've crafted an herbal formula specifically designed to support individuals with NSCLC. This formula focuses on 3 key areas: immune modulation, reducing inflammation and pneumonitis risk, and aiding postoperative recovery and cardiovascular health.
Let's break down the ingredients. First up, we have Astragalus membranaceus, also known as Huang Qi. This herb is renowned for its immunomodulatory effects. It's packed with polysaccharides, saponins, and flavonoids that boost the immune system by increasing T cell counts and enhancing macrophage activity. Essentially, it helps ramp up the body's natural defenses, which is crucial for NSCLC patients.
That's right. Next, we have Scutellaria bicalensis, commonly known as Baikal skullcap. This herb contains baikalin, a powerful flavonoid with anti-inflammatory and anti-tumor properties. It's particularly useful for NSCLC patients undergoing immunotherapy, as it helps mitigate the risk of pneumonitis by modulating the immune response and reducing pulmonary inflammation.
Then there's mullein, or Verbascum thapsus. Mullein is fantastic for respiratory health. Its saponins, flavonoids, and mucilage work together to provide expectorant, anti-inflammatory, and demulcent properties. This means it can help ease coughs and relieve irritation in the respiratory tract, which is particularly beneficial for NSCLC patients experiencing pneumonitis or other respiratory symptoms.
Another great addition is Cordyceps sinensis, a medicinal mushroom known for improving respiratory health and increasing oxygen uptake. Cordyceps also modulates the immune response, supporting the body's overall ability to combat cancer cells. It's like giving your lungs a little extra help in functioning better and staying strong.
We also have licorice root, or Glycyrrhiza glabra. This herb soothes irritated mucous membranes and reduces inflammation in the respiratory system. Its expectorant properties help clear mucus from the lungs, and glycyrrhizin, the active compound, has antiviral and antimicrobial activities. It's like a multitasker, tackling several issues at once.
Lastly, there's thyme, or Thymus vulgaris. Thyme contains thymol, a natural compound with potent antimicrobial and expectorant properties. It's great for clearing respiratory infections, reducing cough, and improving airflow. This makes it an invaluable addition for maintaining lung health.
This formula from the Lost Book of Herbal Remedies is designed to support the body's immune system, reduce inflammation, and help with recovery after surgery. However, it's crucial to use it as part of a comprehensive treatment plan under the guidance of healthcare professionals.
Absolutely. Always consult with your healthcare provider before starting any new supplement. This ensures it's compatible with your overall treatment plan and avoids potential interactions with conventional medications.
The latest research is continuously evolving, and these insights are crucial in refining treatment approaches and improving patient outcomes in lung cancer. We hope this episode has provided valuable information and hope for those affected by NSCLC.
Stay tuned for more episodes where we explore the latest in herbal remedies and cutting-edge research.
Until next time, take care and stay healthy.
Thanks for joining us on the Lost Book of Herbal Remedies.